Are you looking at me?
There we go.
There we go. Well, it's usually the way you do it.
Hey everybody, this is Dr. Hinson. I wanted to take a few minutes to do a short little interview with Dr. Stephen Zodkoy. He's a applied kinesiologist like myself, and he's done some great work with the military, with people in general, but also with PTSD. And he's written an excellent book called Misdiagnosed, and you can get this off of Amazon. And it discusses a lot of the issues surrounding adrenal fatigue and the problems that causes. And Dr. Zodcoy was kind enough to sit down with me for a few minutes here. And could you just tell us a little bit about the work you're doing with the military? And
Sure. What's going on now is, as we all know, there's an epidemic with PTSD and burnout within the military. And I was requested by a general to look into a way of treating it. And so what we came up with was a protocol where we measure brain chemistry using a urine and saliva test. And through that, we're able to give vitamins and minerals that balance out brain chemistry. And the results have been amazing. Our average person improved 40% in both their physical and emotional complaints, which is pretty dramatic, in 90 days. And our study was for 180 days. And by the 180th day, the average drop in complaints was 84%.
wow.
The part I'm really excited about, and those numbers are great, I mean, I'm excited about that.
Right, absolutely.
But the most important part of that was that everybody who went into the program was able to stay on the program. You know, we use 7.2 products, which are very alkalining and strengthening for the body, but they're also gentle and taste good, so people could stick with it. And we use some herbals that are also very gentle, so people can stay with it. But everybody stuck with the program, and everybody improved. There's 5 layers of burnout, and when we started the program, everybody was in the bottom 3. And when we finished the program, most people were in the top 2, and a few were in the middle. But that means that the program that that I designed is so efficient that, well, everybody's going to move better. It may not be the whole answer for you, but it's going to be the whole answer for some of them. But even if we move you up a step or two, let's say you had PTSD, that's you're 40–50% better. The next step might be bring you another 30 or 40% better.
Right.
We don't want to go with the idea that this is the only way to go, but it's probably the greatest first step because we're moving so many people ahead, and it's easy. So we've duplicated the study a couple of times, and the results are about the same. And it's been so successful that we've now received a grant to help veterans get onto this program.
Yeah.
When I was in the Pentagon, we were talking to the Undersecretary of the Navy and 4-star generals for the Marine Corps. There's about a table like this with 20 or 30 people in there. The commander, his name is General Dunford, a 4-star general, pulls me aside and he goes, "Steve, if you could help 7 or 8% of my men, I'd be internally grateful."
Wow.
And now we're looking at, really helping 100% of them improved, and at least 50 or 60% of them are back to normal. Do you mind if I tell a story?
No, go for it, please.
So, one of the best stories, and I love this one because it just happened. There was a Marine an unbelievable Marine, traveled to Afghanistan, went from a regular corporal to a sergeant to a master sergeant, all in the course of like 8 or 9 months. So he was a go-getter. I mean, it was an amazing rise, and he had a lot of men under his care. And when he came back from Afghanistan, he was so spectacular that they picked him out of the ranks and turned him into an officer, which is rare. And during his officer's training, he passed his officer's training, he had severe PTSD. And what happened was he was actually unable to function. They had to pull him out, and they had to let him decompress. And for 1.5 years, he was receiving therapy. He was receiving counseling. He even went to outside counseling. He did everything, and he couldn't get rid of his PTSD. He couldn't function at all. And so the Marine Corps said, we're going to put you out, full disability, and we appreciate your service. His file was to be signed by this general who releases these people, and she's like, "We can't release him. He's too bad. We need to get him care." And so they shipped him from, they put him on, they called me and asked him if we could put him on a program. We put him on, we did the testing, nutritional testing. We put him on nutritional products for 30 days. He came and worked with me one-on-one for 2 weeks, returned back to Pensacola, passed his physical, passed his psych exam, and requested to finish his tour. That was 3 months ago, and he's doing fantastic. He's back. So, you know, not only did we save ourselves a Marine who they spent $1 million training, we gave him back his life, we gave him back his 2 kids, have a father again, and a wife has a husband.
Right.
And it's great. It's easy, it's efficient, and we really need to get the word out there so that we can do more and more soldiers in the
That's
ranks.
great. Well, I know that in my family I have individuals suffering from PTSD, and so when I listened to your talk yesterday and saw the book and began reading through that, I was really excited because the book basically takes a lot of the principles that you and I both use in our practice with applied kinesiology and NET and good nutrition and those techniques have just gotten really great results, and so I'm really wanting to get the word out, and I appreciate you taking the time to sit down with me.
No problem.
And do that.
It's amazing. We're always, it's a serious problem.
Right.
And they're looking for the most complex solution for it. If they would pull back, if military medicine would pull back and look for a simpler approach, these guys are all burnt out, hyped out. Start them alkalizing. You know what I mean? Step one.
Right.
You can't fix a burnt out car. You gotta repair it. You gotta alkalize it, and then you strengthen it. And then you know what? The therapy, the cognitive behavioral therapy, the NET, neuro-emotional therapy, will work so much better.
Right.
And that's why even in my own office, we do nutritional supplementation to alkaline, and then we do the emotional work, and it works fantastic.
Oh, great. Well, all the information that Dr. Zodkoy is talking about here is in his book. All the information on the nutrition, the alkalizing, and the applied kinesiology and NET is in there. So you can get this on Amazon. It's also available on the Kindle, so definitely check it out. And thanks so much for your time.